Have you ever witnessed a situation when an individual is going about their daily activities and everything seems to be so fine? Next, the person slumps, and we are left with the stark reality that the person is gone. Dead. Have you? That is cardiac arrest for you. And apparently, we're having a lot of cases in Nigeria these days. Your health is your wealth. And nowhere else is this more evident than in the matters of the heart. So, ladies and gentlemen, you're welcome to the Circle Direct podcast. And today, we'll be talking about cardiac arrest. Now, cardiac arrest, when it occurs, it is sudden. It is unexpected. It is life-threatening. And it's a stark reminder that we got to take our heart very serious because our heart health is not negotiable. But what exactly is cardiac arrest, and how can we prevent it? Cardiac arrest happens when the heart suddenly stops beating and there's a cutting off of the flow of blood to the brain and other organs. And it's different from heart attack because heart attack involves a block of blood flow to the heart as a result of pulmonary embolism. But cardiac arrest is often triggered by an electrical malfunction that disrupts the heart's rhythm. And without immediate medical attention, it can be fatal within minutes. 9 out of 10 people who have cardiac arrest outside of the hospital, they often die within minutes. Is that serious? A person can be said to have cardiac arrest if the following is happening. 1, the person collapses and suddenly loses consciousness. 2, the person is finding it difficult to breathe and is gasping for air. 3, the person does not respond to shaking and shouting or the calling of his or her name. 4, the person does not have a pulse. Cardiac arrest can be treated effectively if action is taken right away, no matter the location, whether it's in the hospital, outside, in the playground, anywhere. But treatment has to be introduced within the first few minutes. Survival rate can reach up to 90%. However, the chances of survival, it decreases with every additional minute. And in every additional minute, the survival rate decreases by 10%. If cardiac arrest is not treated within 8 minutes, it can lead to the death of the person. And if it's not treated within 5 minutes, or if CPR is not introduced within 5 minutes, it can lead to brain damage. CPR stands for cardiopulmonary resuscitation. It is the first intervention that must be introduced in these cases. And it's not pouring on water like many people do in Nigeria. CPR involves pumping the blood. I'm sure you've seen paramedics putting their hands on the patient's chest, trying to get the blood to flow. In many films, in many programs, it involves pumping the heart to ensure that there's flow of oxygen to the lungs. When you're doing the CPR, it's important that at the same time you are reaching out to an ambulance. Ambulance in Nigeria. We don't have adequate ambulance services in Nigeria. But then again, if you have access to one, should quickly reach out to one. Another intervention that the ambulance service team can do is the use of an automated external defibrillator. The defibrillator restores the heart's beat by delivering shocks to the heart. It's a very, very important tool that all ambulance services should have. So what are the risk factors for cardiac arrest? And who is at higher risk of developing the condition? 1, if you've had a sudden cardiac arrest before and you have a family history of that. 2, if you have a personal or family history of abnormal heart rhythms like long QT syndrome and ventricular tachycardia. 3, if you've had a certain kind of arrhythmias after a heart attack. 4, if you've had heart or blood vessel issues since birth. And 5, if you've had a heart valve disease. 6, if you have a history of fainting. 7, if you have heart failure from conditions like dilated cardiomyopathy. 6, if you've had hypertrophic cardiomyopathy. The next one would be if you have major changes in the amount of potassium, magnesium in your blood. If you're obese, if you've had diabetes, if you take recreational drugs, drugs that can increase the risk of life-threatening arrhythmias, all of these individuals are at risk. But the good news is that cardiac arrest can often be prevented. And let's explore the practical ways we can take to protect our heart and avoid this silent threat. Number one is know your risk. Factors like high blood pressure, high cholesterol, diabetes, a family history of heart disease, all of these increase the likelihood of developing cardiac arrest. So you got to do regular checkups and do regular routine comprehensive testing. See your doctor regularly so that they can help identify and manage this risk early once it's detected. Two, you got to stay active. Physical activity is the cornerstone of heart health. Aim for at least 150 minutes of moderate exercise every week. And you don't have to run, kill yourself. What you do, you can do brisk walk, you can do cycling, you can swim. Because exercise is strengthening your heart and they improve the circulation across your body. Three, you got to eat smart. You got to eat balanced diet, rich in food, vegetable, whole grains, lean meat, healthy fats. All of these are essential. You got to cut down on sodium and trans fat because all of these can contribute to high blood pressure and cholesterol. And those two conditions are major culprits in heart problems. Four, you got to quit smoking and limit alcohol intake. Smoking damages your vessel and it can increase the risk of arrhythmias, while alcohol over time can weaken your heart. Over time, it takes a while. If you want to stop smoking, you can seek support. There are a lot of help groups that can help people stay off addiction. And if you must drink, you must really taper it down, take it in moderation. Five, you need to manage stress. Chronic stress has a way of putting so much burden on your heart. And you got to find a healthy means of taking out stress. Meditation can help. Spending time with loved ones can help. Mindfulness can help. A lot of things can help. Because you got to remember, your mental health is as important as your physical health. Six, you got to learn skills like the CPR, cardiopulmonary resuscitation, and the AED, automated external defibrillator. You got to learn how to use this device. Because sometimes, no matter what you do, cardiac arrest can still occur. So you got to take preemptive steps by learning these skills, as these skills are invaluable and can just be the difference in a life or death situation with these patients. Seven, you got to stay vigilant about the symptoms. Look out for the warning signs. And they include things like chest pain, shortness of breath, irregular heartbeat, or fainting. When you have these things, do not ignore it one bit. Quickly seek medical attention for prompt intervention, because these things, they are the precursors of cardiac arrest. In summary, timely intervention is very crucial in the cases of cardiac arrest to minimize the likelihood of the risk of brain damage and even death. Remember, your heart is like an engine. It is a powerhouse and it's powering everything that you do. So you got to protect it. And protecting it is not just avoiding the disease itself. It's about living a full and vibrant quality life. So by prioritizing your heart health, you are not only securing your physical well-being, you are safeguarding your wealth in its truest sense. Remember, at Cycle Direct, we always advise you to carry out regular routine comprehensive testing and checks with your healthcare provider, because at the end of the day, your health is truly your wealth. Treasure it. Thank you.